All right, let's talk about something that's quietly changing, well, just about everything. Artificial intelligence. And, healthcare might be one of the most important places it's making a difference. Today, we're going to see how AI helps doctors tackle a really tough medical puzzle. And we're going to do it by following the story of just one patient.
So let's jump right in. This is Mr. Farouk. And his story, well, it's more than just a medical file. It's really the key to understanding how we can use data in a profound way to change a person's life, and honestly, to chart a whole new course for the future of medicine itself.
You see, to really get the power of this technology, you can't start with the algorithms. You have to start with the person. So let's get to know the man at the very heart of this story.
Okay, so who is Mr. Farouk? Well, he's 68 years old, he's a retired textile worker, and he lives in an industrial part of Cairo. Now, a couple of these details are really important. He has a 40-pack-year smoking history, which, is a significant amount, and he keeps getting these really nasty chest colds that have him going back to the doctor again and again for antibiotics. But his main complaint, the thing that's really scaring him, is that it's just getting harder and harder to breathe. For his doctors, Mr. Farouk's case is a puzzle. It's a common one, but it's really tricky. All the pieces of the puzzle are right there on the table. But the real challenge is figuring out how to put them together to see the whole picture. And, more importantly, to predict what's going to happen next.
Let's look at the clues just like his doctors would. First up, his age, 68. He's at that point in life where a chronic condition like his can start to get worse and fast.
And here's a number that really tells the story. His lung function is only at 43% of what it should be for a man his age. Just think about that for a second. His lungs are working at less than half capacity. On top of that, his blood oxygen is down to 89%. Now, you and I are probably sitting here somewhere between 95 and 100%. So that 89%, it shows his body is really struggling to get the oxygen it needs to function.
And remember those chest colds? He's having serious flare-ups 3 times a year. And every single one of those episodes can cause more permanent damage to his lungs and seriously increase his risk of ending up in the hospital.
So you see the problem, right? We have all these data points, all these warning signs. But how can a doctor possibly take this complicated mix of a patient's history, their vital signs, their lab results, and accurately predict a major crisis before it happens? Well, that is the exact question where AI comes in.
So how does AI even begin to tackle something this complex? Well, it's not some magic wand. It's actually a system, and it's designed to do 3 very specific, very powerful jobs to help someone just like Mr. Farouk.
Here's how it works. First, there's risk stratification. This is basically figuring out of all the patients, who is most likely to have a major problem soon. Second, phenotyping. This one's fascinating. It's not just about knowing he has COPD, but figuring out his specific type of COPD. And finally, tool utilization, which is all about picking the right AI tools to make sense of this mountain of data.
So what are these tools we're talking about? Let's pop open the AI toolkit and take a look at the core technologies that actually make this whole analysis possible.
Okay, first up is a technique called unsupervised clustering. Just think about it like this. You hand the AI thousands of patient files. With 0 instructions, it just starts reading through them and finding hidden patterns, grouping similar patients together. The analogy here is perfect. It's like a genius librarian who starts organizing books into new categories you never even knew existed, revealing connections you'd never see on your own.
And this is what comes out of it. The AI creates these distinct patient profiles, these phenotypes. For example, one group might be frequent exacerbators, who have a ton of inflammation. Another group might be more about emphysema, which is actual physical damage to the lung tissue. And here's the kicker. These 2 groups need completely different kinds of medicine.
This is where it gets personal for Mr. Farouk. The AI can look at all his data and say, with a high degree of confidence, he belongs in the frequent exacerbator group. Now, that's not a guess. It's a data-driven classification that immediately points his doctors toward a much more precise and effective treatment plan.
So the next tool in the kit is called natural language processing, or NLP, and this is pretty much magic. It allows AI to read and actually understand human language. Just think of all the incredibly valuable information that's locked away in a doctor's messy, unstructured notes. NLP is the key that unlocks it.
So for example, the AI could scan a doctor's note and pull out a phrase like increased sputum purulence, which is just a clinical way of saying there are signs of infection in what he's coughing up. Or it could spot the words textile worker and flag a potential occupational exposure. Then it takes all this messy human language and turns it into clean, structured data that a computer can analyze.
Okay, so we've got the patient's data, and we've got these incredible AI tools. Now let's put it all together and see how this actually works. The step-by-step process that turns all that raw information into a potentially life-saving decision.
This is basically the AI's thought process. Step 1, data ingestion. It vacuums up everything about Mr. Farouk, vitals, labs, those doctor's notes, all of it. Step 2, feature engineering. This is cool. It actually creates new data, like calculating the rate his lung function is declining over time. Step 3, classification. It compares his unique profile to thousands, maybe millions of other patients it's learned from. Step 4, probability output. It spits out a clear, simple risk score, something like there's an 85% chance this patient will be hospitalized in the next 30 days. And finally, step 5, decision support. It actually suggests a potential treatment plan for the doctor to review, all of it backed by that deep analysis.
So what's the big picture here? What does this all add up to? Well, it's not just a fancy new gadget. This represents a fundamental move toward a much smarter, more personalized kind of healthcare for every single one of us.
And let's be really clear about something. This is not about replacing doctors. Not at all. It's about augmenting them. It's about giving them superpowers, the ability to see patterns in data that no human could ever spot, and to see into a patient's future with a kind of clarity we've never had before.
So if you take away one thing, it's this. AI is reshaping what medicine can be. It's becoming predictive, so we can see a crisis coming before it ever hits. It's becoming truly personalized, so we're treating the individual person, not just the name of their disease. And maybe most importantly, it's becoming proactive, letting doctors step in early to keep people like Mr. Farouk healthy and at home, instead of in a hospital bed.
And that kind of leaves us with a pretty big question to think about, doesn't it? We've seen how AI can help predict the medical future for one person. But as this technology gets better and better, as it starts to predict our medical futures, how is that knowledge going to change the choices we make and the way we live our lives every single day?